Hello, I'm Nancy Schmidt, Vice President of Referral Relations and Admissions for the Spaulding Rehabilitation Network, and I'm responsible to help patients and families transition from acute care to rehabilitation. I'm sure the past few days and weeks have been difficult and challenging. You and your family have been through a lot and have already made so much progress. Now comes the next big step, your rehabilitation care. You probably have a lot of questions. You may even wonder what rehabilitation means. This is completely normal, and this is why we have created this video for you, so that you will get a sense of what our facilities look like and better understand what to expect in this next phase of your recovery. Our entire team is honored to be here to help you at this critical time in you and your family's lives. Thank you.
The Spaulding Rehabilitation Network cares for patients in inpatient hospital settings and outpatient therapy locations. Spaulding has 23 outpatient centers and 6 inpatient facilities across eastern Massachusetts, from Cape Ann to Cape Cod. Each year we serve thousands of patients in both our outpatient centers and our inpatient rehabilitation facilities. Your care will begin at an inpatient facility. At each one of our inpatient facilities, we customize your rehabilitation to meet your individual needs. Our clinical teams meet regularly to design a rehabilitation program that will help you reach your maximum level of recovery. All of our care, from rehabilitation therapy to recreation to nutrition, is patient-centered. The goals for rehabilitation are to help you understand your particular diagnosis, to help you achieve your highest level of function possible, to help you get back to the activities that you enjoy, and enable you to adapt and succeed in your environment. Rehabilitation, at its core, is about helping you reach the best quality of life attainable. Our therapists and clinicians at Spaulding use the most advanced techniques and the most cutting-edge technologies available. They always strive to use these technologies in creative ways to enhance your rehabilitative care. If there's a new idea, method, or device that could strengthen your rehabilitation, you can trust that your Spaulding team is implementing it. From simple adaptive technologies to complex robotics, your team works together, continually modifying and fine-tuning your therapies in order to achieve the optimum results for you.
There are countless benefits to the Locomat, and I think the principal one is the first time you see yourself up and walking, it just puts a smile on your face and a tear in your eye because you realize that there is hope, and that's extremely important.
Suzanne Hevner is a clinical liaison for Spaulding Rehabilitation Network. A clinical liaison has a background in nursing, therapy, or social work and helps patients and families transition from the hospital to the next level of care. Suzanne is one of the many liaisons on staff who meet with families and patients like you to explain what to expect and to answer your questions.
When you get to Spaulding, you are going to have good, caring rehab professionals that have expertise in this area. Oftentimes, the physicians can give a call over and have a discussion with the doctor that cared for you here at the acute care. So it's a very nice back and forth. We make sure we hand off as much information as possible to set you up in that transition. And then the first few days, the post-acute care is going to take that time to get to know you.
You have been referred to Spaulding Rehabilitation Hospital Cape Cod, a member of the Spaulding Rehabilitation Network, anchored by nationally ranked Spaulding Boston. Since opening in 1995, Spaulding Cape Cod has led the region in introducing advanced technologies and has developed many quality programs that not only enhance patients' safety and recovery, but promote high patient satisfaction as well. Spaulding Cape Cod's medical staff is exemplary and includes rehabilitation physicians, a neurologist, and an internist. A physician is on site 24/7. The nurse-patient ratio at Spaulding Cape Cod is among the best in the area, and nurses monitor patients hourly to ensure their needs are always met. Everything at Spaulding Cape Cod is designed to facilitate the rehabilitation process for patient and family. Specialty inpatient programs include stroke, Parkinson's disease, brain injury, orthopedic injuries and surgeries, as well as cardiac rehabilitation and trauma. Spaulding Cape Cod is set on a 44-acre wooded campus with lovely therapeutic gardens and a putting green and therapeutic pool. Not only do patients at Spaulding Cape Cod benefit from the latest research in therapy, but also from Spaulding Cape Cod's intimate healing environment. The adaptive sports program helps patients return to favorite activities, discover new ways to engage with family, friends, and the community, and to live beyond boundaries. Spaulding Cape Cod offers inpatient rehabilitation or acute level of care, to see patients frequently, intensive therapy services, specialized rehabilitation nursing care, and clinical resources such as on-site pharmacy and radiology services. Within 24 hours of admission to your new facility, you will be evaluated by a number of rehabilitation professionals. After evaluations are completed, your team will work with you to determine your rehabilitation plan of care. Depending on your condition, therapy may include physical therapy, occupational therapy, speech therapy, or other therapies, which will be provided in one-to-one and/or group sessions.
In the beginning it's not just getting up and walking right away. Sometimes it is moving around in the bed. Sometimes it is just learning how to go from lying down to sitting up. There's many nuances that we don't realize that are just kind of taken for granted while we're in the hospital and getting everything taken care of, that we need to start translating into becoming more independent.
As you and your family prepare for the next level of care, you probably have some questions, such as, what about parking? At Spaulding Boston, there is on-site parking for a small fee, and the hospital is steps away from public transit from North Station. What do I need to bring? A rehabilitation hospital experience is very different from an acute hospital stay. You will participate in a variety of activities each day and should bring comfortable, loose-fitting clothes like sweatpants, sweatshirts, shorts, and t-shirts, as well as comfortable sneakers. You will need to bring any personal items or medical equipment that you require, such as reading glasses, hearing aids, and custom devices. As part of the rehabilitation stay, we encourage you to bring pictures and personal items from home that will make you feel comfortable in your room. All of our facilities have free Wi-Fi for patients, families, and visitors. What about insurance?
There may still be questions, and at that point we have financial counselors at each of our sites that can either meet with the patients or their caregivers to make sure that all of those anxieties about payers and questions that come up can be answered for them.
What will my room be like? Depending on your needs, your room will be private or semi-private. You'll have a telephone, TV, and a fully accessible bathroom in or near your room. What about food? You'll have 3 nutritionally balanced meals delivered to you every day. Your menu will be tailored to meet your medical and dietary needs. What will you expect from me?
Your job in rehab is to work as hard as you can. Take advantage of this time, take advantage of having those rehab experts right there at your fingertips, and make sure that you feel confident in the strength that we're going to build for you.
What about my family? Your family is an important part of the team, and we encourage them to be present whenever they can help your healing. What happens when I leave my rehabilitation hospital or care facility? Your recovery does not stop when you leave Spaulding. We will work with you to arrange ongoing care through home care or outpatient therapy upon your discharge. In other words, when you finish your course of rehabilitation at Spaulding, we will still be there for you.
Hello, I'm Dr. Ross Savant, Vice President of Medical Affairs at the Spaulding Rehabilitation Network. We hope this video has been helpful to you as you prepare for your transition to one of our rehab facilities. Our caregivers are some of the best in the world, and you can trust that we all share the same values and dedication to excellence. Helping you reclaim your strength is our #1 priority. We are truly honored to serve you, and we look forward to partnering with you and your family. Thank you.